And then we're going to get into the whole fun stuff on magnesium. So as I said, today, June 27th, 2024, statements made in this presentation are not meant to treat, cure, or diagnose disease. And as a refresher, because there's a lot of new names in here today, and I always appreciate you being on and taking the time to be here, we have our EPIC conference, October 4th through 6th, 2024. And the early bird special ends June 30th. So I'm going to send out the link to that website, but it's EPIC Functional Medicine Conference, epicfmconference.com. But June 30th is the early bird special. We're going to have 6 great speakers, 2 on cardiology, 2 on GI, and 2 on hormones. You're going to get lunches and dinners and happy hours, and hang out with the owners of Biotics and all the reps from Biotics. So definitely take a look at this conference. It's going to be a very exciting time. All right, so months ago, well, basically almost a year ago, a little bit longer, I introduced Electrolyte Forte. And blessedly so, I guess. There's always a learning curve to things, and I get a lot of great questions. And I know one of the people on this class today sent me a video of what's going on social media. And all due respect, many of you know I'm not a doctor, never claimed to be a doctor. I'm not that smart as all of you are out there, or even these amazing clinicians that I get to learn from every day. But this video on social media was a doctor, and he was really bashing the low sodium electrolyte world. And I'm being cautious how I say this. But many of you know about our Electrolyte Forte, and it's a low sodium product. Remember we talked about, here's sodium outside the cell. Here's magnesium and potassium inside the cell. A lot of the fancy brands out there in the retail market, and what this doctor was talking about was the need for sodium. Well, when we look at these videos and your patients, your clients come to you with this information, it takes a little bit to disseminate it. And this doctor was really speaking about the need for sodium, but through his video, he talked a lot about the high-end athlete. Well, I don't think all of us are high-end athletes. I know my mother, who's 82, is not a high-end athlete. She hasn't run a marathon lately. All due respect to her, but she loves our Electrolyte Forte because she has high blood pressure, doesn't walk the walk per se, but has high blood pressure, has other things that sodium really isn't needed in her program. But all of these other electrolytes are. When I reached out to one of my people in my world that I respect highly, and I asked him the same question of what's your world on high sodium, low sodium electrolytes? And he goes, I'm reading his text message over here. He goes, hope all is well. IMO, salt is cheap and why pay top dollar for it? And me being an old person, I had to look up on text messaging what is IMO, and it's in my opinion. I'm a little slow, but I had to admit that. But I'm like, what's he getting at? IMO what? So in my opinion, salt is cheap and why pay top dollar for it? And that's my opinion too. We have an amazing electrolyte formula for you, a very therapeutic formula that I have shown you time and time again of how it has helped people in the athletic world also, but in the day-to-day. I'm a day-to-day kind of guy. I'm out in the heat in sales. This is what I drink. I don't need high sodium. We need water inside the cell to feel hydrated. We are magnesium, we are potassium deficient. We're going to talk about magnesium today. Take note, the magnesium in the Electrolyte Forte is magnesium glycerophosphate. All right, we're going to talk about that a lot today. But we need the water inside the cell. So people go, oh, it doesn't taste great. Yeah, it's not salty, it's not sweet, it's therapeutic. So not that I don't agree with some of the social media information of you need sodium. You know what? Take a little bit of Celtic sea salt. Again, the bang for the buck, you're getting a lot of value here, where in high salt, high sodium electrolytes, you're paying a lot for a little. Because potassium, the forgotten electrolyte, is primary intracellular, minimized in most formulas. And here it is. Here's the potassium, sodium. Here's your potassium, very dominant inside the cell. Here's your sodium very dominant outside the cell. So sodium increases extracellular fluid volume, not intracellular. And if you look at our formula, here's the sodium. One of the big brands out there is 1,000 milligrams of sodium that everybody loves because it's tasty, it's salty, it's sweet. But is it really therapeutic for the everyday user? You know, here's your 320 milligrams of potassium, and here's 150 milligrams of magnesium as the glycerophosphate form. All right. So I just want to touch base on this. And I think I'm going to be doing a little bit more of this to help guide all of us as we get all these questions from our customers and our clients about, oh, well, social media says this, or the website says this, or, you know, the internet is telling me this. Let's talk about these things. Let's go over this as a group. This is one man's opinion, but I did reach out to a lot of brilliant minds. This is just one text message of, you know, I want to cover my bases and make sure I get you the most beneficial, accurate information. Right, so let's dive into magnesium. And as I said early on, when I dove into this, I didn't know I was diving into an 8-hour lecture on magnesium. There are so many different forms, and there's the IV forms, and there's the form. I was in Cottonwood, Arizona yesterday, and the doctor had 6 different magnesium supplements of different carriers. And I'm going to try my best to cover the most important ones, and we'll have the chat box at the end for talking about different carriers, because Biotics has specific ones. I'm obviously going to talk about those today, but we'll integrate the others as well. And as I mentioned in the chat box, please be aware, for those of you that are new, that at the end of these, well, 35 minutes, I have a question and a raffle. And I actually am going to raffle off a nice product today. And I'll tell you which one it is as we're talking through it. And as we're talking through it, take note what the raffle question may be. So the chat box will open it up later. Jacqueline is sitting over here looking at the chat box if you have any specific questions, which we'll answer later as well. Let's dive into magnesium. So as an overview, on the left, you see in the slides the products that from Biotics that are magnesium specific. You have Actimag Plus. We've talked about it in the past, but we're going to talk about it more. We have Aqueous Mag Chloride. We'll talk about that one too and its benefits, but it's a tough one to get in the system. Lipid X, Magnesium Orotate 500, and MGzyme. Many of you may be familiar with all of these or just a few of these, but I'm going to show you why and when to use these. So magnesium recommended intake, men 420 milligrams, women 310 to 320 milligrams a day. There's no way in most cases that we're getting that in. So it's an essential mineral. Many of you know this. It cofactored more than 300 biochemical reactions in the body. And yet, as I said, I will show you, we are very highly magnesium deficient. Structural development for bone is very important, plays a role in active transport of calcium and potassium ions across cell membranes. So think heart, nerve, muscle function as we think of using different forms of magnesium. Additional roles, natural occurring calcium channel blocker. So when you think of cardiovascular issues, but also think of excitatory issues of people with anxiety. This is kind of that pathway as well. Too much calcium, magnesium calms it down. Involved in the maintenance of electrolyte balance. We showed that in the slides previously. How important magnesium is as an intracellular ion with potassium to get water inside the cell. Not that, please don't take this story that you don't need sodium. But what I was saying about these electrolyte products is these high sodium products that people are thriving on and drinking a lot of are causing a gradient issue of imbalance, okay? I'm all about balance. Plays a key role in membrane excitability, just what we talked about. From an excitatory standpoint, it helps bring it down a notch. And being the second most abundant intracellular cation, magnesium is involved in almost all major metabolic and biochemical processes, as we talked about, over 300 in the body. So here we go. Stressed out. 3 out of 4 Americans report stress-related symptoms. That is a large number of people. Stress depletes magnesium. So right there, we're already at an imbalance, because I think you could say, if you interviewed your clients, your patients, that I'll be real, 9 out of 10 could say they have a stressful lifestyle at some level. Something is stressing them at that moment in time. They are depleting magnesium. And I want you to be aware, for those of you that look at a lot of blood chemistry, and I know many of you know this, but I had a dear mentor who taught me a lot about blood chemistry, that serum magnesium is a poor indicator, a very poor indicator, because what do we say? It's intracellular. So if a patient or a client comes to you with their allopathic blood work and the magnesium looks okay in the serum, don't trust that. Because we're going to show you a lot of subjective indications for low magnesium. But a true indicator of magnesium status is red blood cell magnesium. So as I said, stress. Here we go. Depletes magnesium, causes anxiety, causes more anxiety, low magnesium level, causes more anxiety, depletes magnesium. It's a vicious cycle of when we have stress, we're depleting magnesium. That low magnesium causes a more excitatory response. That more excitatory response depletes more magnesium. Thus the need, as this doctor last night in Cottonwood had 6 different magnesiums on the shelf, because he knows that stress is a major, major issue for all of health. What did I say? 300 different enzymatic reactions with magnesium. And we're depleting that based on a stressful lifestyle. So as a clinician, as a doctor out there, I used to do my talks, I call them back to the basics, foundational nutrients. I would put this in a foundational nutrient category. I understand when you're working with your clients and your patients, it's like, what's the most bang for the buck based on cost of their supplement package? I'll show you a few that I think really cover a lot of bases. So symptoms of magnesium deficiency and stress. So on the left column here is stress: fatigue, irritability or anger, feeling nervous, lack of energy, upset stomach, muscle tension, headaches. I mean, these are your people. These are your people. We see them every day out on the road or at the grocery store or wherever. But look at symptoms of magnesium deficiency that are referenced: tiredness, irritability, mild anxiety and nervousness, muscle weakness, gastrointestinal spasms, muscle cramps, headaches. I know many of you know this already, but maybe steal this chart and have this on your desk to show your client, your patient. Visuals are very powerful for them to follow a program. Show them you're here and magnesium deficiency here, and they're very, very related. I think your compliancy may go up. And we've always talked about magnesium helps make GABA. Here's your magnesium pathway from glutamine to glutamate. B6 and magnesium help make GABA. So that's why people feel good on the right magnesium. And when patients come to you and they say, well, I've heard about magnesium loosening up the bowel, we're going to talk about that. Because yes, that's a component. But how do we get an amount of therapeutic magnesium in? Look at this, 50% are magnesium deficient. More than half of adults in the US do not get enough magnesium in their diets. I'm not sure how you're going to get enough in with these foods listed, because a lot of people don't eat like this. This is why they're partly magnesium deficient and a stressful lifestyle. Not a lot of people eating kelp, pumpkin seeds, look at almonds. Look at how low, like these are low numbers, but meaning these people aren't eating enough of these foods to get a therapeutic level in. 57%. Half of your patient population, half of your client population is magnesium deficient. And if you think about their subjective indications that they come to you on the other side of the desk for, I bet a lot of them fit that profile. Then look at the drug nutrient interactions. Left column, the drug group, the mechanism of effect. All right. Look at some antibiotics at the top here. Increased renal magnesium loss. Antimicrobial medication, increased renal magnesium loss. The list goes on. Bisphosphonates, if you know any of your clients on those. Renal impairment, magnesium excretion. This is a nice chart to have as a reference for you as well, because look at it, protein pump inhibitors. How many of your people are on protein pump inhibitors? Loss of active magnesium absorption. Thiazides, increased renal magnesium loss. Not anti-medication, but look at what these medications are causing. Another great chart, as I said, to have as a reference. And maybe what I'll do is I'll create these two last slides I said would be a great chart as a reference. I'm going to make a note. I'm going to pull them from this PowerPoint, put them into a PDF picture so you have them as an individual to send to you in my email follow-up that you'll get this recording and these items. So the drug chart. Got it. Okay. And then again, here you are. You know, when we talk, it's just to get the point across. I'm not trying to be redundant, but when we hear it a few times, it will stick. Magnesium deficiency, anxiety, asthma, depression, fatigue and irritability, nerve problems. You know, people come to me and say, what do you have for neuropathy? Well, B12 is huge, but so is magnesium as well. A side note, people who are not responding to supplemental vitamin D may have a magnesium deficiency. And I want to give credit where credit is due on a lot of this information is my dear friend, Dr. Arlen Hill, who we have texted and emailed back and forth about this topic. So he just refreshed me this morning about the vitamin D component of, we have a very effective vitamin D, you all know that, Biodemulsion Forte. But sometimes when the patient isn't responding, think of magnesium. I know there's genetic SNPs to look at as well, but magnesium is a very important component. But look at Raynaud's syndrome, osteoporosis. We talked about the bone health and magnesium. It's not just calcium. So Actimag Plus. This is going to be the first one we're going to talk about. This is magnesium glycerophosphate. Remember in the electrolyte forte, magnesium glycerophosphate. The lowest on the laxative effect of the form of magnesium. Right down here, towards the placebo group of incidences of 7. Highly absorbable, no laxative effect, okay? Now, is this not going to happen to anybody? No. The challenge and the beauty of nutritional science is sometimes we all get a little surprised. I have had a couple cases where they said, well, it kind of caused a laxative effect. Dose it down a little bit, okay? You are getting 400 milligrams of elemental magnesium in a little scoop with that glycerophosphate carrier that generally, in most cases, is not going to loosen the GI. Examples, everybody in this family uses it. I have a golfer who uses it on the golf course. He's not had a problem in 5 hours. So be aware of that it's a very therapeutic product that will not loosen the GI. Here, glycerophosphate bonus. All magnesium supplements are mineral salts, so it's a carrier. We're going to talk about the carriers. Magnesium glycerophosphate is magnesium attached to glycerol and phosphate, 2 substances also used by the body to help produce energy. Here's a great note. 1 molecule of glycerophosphate can be used to produce 19 molecules of ATP after passing through the Krebs cycle. You see this big carrier, that's the glycerophosphate carrier. So you get 19 ATP out of this wonderful carrier that's not loosening up the GI, and you're getting 400 in this product in 1 serving, 400 milligrams of elemental magnesium. What was the needed intake for a male and a female? 350 to 400 some milligrams, correct? Affecting 300 different enzymatic reactions. Now we're in a therapeutic dose. Remember, we've talked about this before. Taking a milligram of something isn't going to do it. You know, they're taking their Centrum, literally, but they're not getting any therapy out of it. This is a therapeutic effect. You also, by the way, have a glycerophosphate shuttle in the brain and in the muscle. Helps with NAD. Everybody's talking about NAD lately and energy. So another component of that carrier. It's not in the slides, but let's talk about it. Magnesium threonate that most and many of you are familiar with. Magnesium threonate crosses the blood-brain barrier that was all talked about for anxiety and mood disorder. In about 2,000 milligrams of magnesium threonate, that carrier is massive. That I believe you're getting about 75 milligrams of elemental magnesium. Is that therapeutic? Or do you want a product that has 400 milligrams of elemental magnesium that's therapeutic with a glycerophosphate carrier? You have a glycerophosphate shuttle in the body. You do not have a threonate pathway in the body. So again, we talk about bang for the buck. Here's bang for the buck. So look at this. I just pulled these this morning, so I apologize if they're a little sloppy. But from NIH website, magnesium glycerophosphate is the ideal form of magnesium to help boost sleep quality. It helps the body and brain relax by activating the parasympathetic nervous system. Love that. You've heard me talk about sympathetic, parasympathetic. We are all wired and fired over here. That's that stress, that's anxiety. Let's bring up parasympathetic tone with magnesium glycerophosphate. Magnesium also helps boost the sleep hormone melatonin, which in turn binds to GABA. I mean, that's a wonderful little component. Look at this. Another one. Magnesium ion blocks the ion channel for NMDA receptor and prevents excessive excitation. We talk about NMDA receptors in the brain and excitatory components. Calms it down. I had a video I was referenced like 2 years or a year ago or so of a little boy. I tried to bring it up on my laptop, but it wasn't working. I'm not that great of a tech guy. You know that. But this little boy was visiting from out of town with terrible tics brought on by nervousness and excitation. So I had a bottle of the Activate Plus. He was visiting a friend. I said to the friend, I said, give him a scoop of this. He actually made me a video. I think it was 2 days or 3 days later. And he said, Mr. Daniel, I don't know what to call you, he said, but I wanted to show you on video that my tics are basically non-existent based on just one serving per day for 2 to 3 days. That's what's happening here. We are decreasing the excessive excitation. Glycerophosphate from the Journal of Neuroscience, it can also assist in the proper development and maintenance of nerve function of the body. Magnesium glycerophosphate supplements can also be taken for certain diseases, such as blood pressure, high levels of cholesterol, recurring chest pain, and heart attacks. Now, again, I am not treating or diagnosing. I'm just pulling from the journals on the effectiveness of magnesium and proper carriers. But I'm going to share this study with you. Chronic atrial fibrillation. Hard to read this little slide, but here it is. Magnesium glycerophosphate was the elemental magnesium used for an atrial fib study. So you may be, gosh, Daniel, you're making this seem like it's the be-all, end-all. It's not. But when I talk about bang for the buck and what's on your shelf, many of us are concerned I don't want to have too big of an inventory. I feel that you cover a lot of bases with this product. Being in a powder, it's titratable, it's palatable, and you're not loosening up the GI. Now, if you want to loosen up the GI because you have somebody that's constipated, let's keep on with this story. So we have aquamarine chloride. I'd be curious, I don't have the chat box in front of me, but how many of you have ever tried this product? I bet it's very few hands going up, all right? Because look how simple the carrier is here, chloride carrier, nothing fancy. Tastes horrible, chloride, salty. I've heard other ways to describe this product, which I will not say on this video, but it's an acute application of magnesium, safer than magnesium sulfate, largely used for pain relief and musculoskeletal disorders. A quick responder, also seen with cardiovascular applications, arrhythmias, and metabolic syndrome. I do know of some doctors out there who have IV rooms and things of that nature, and they're running blood pressure on people before they check them, and their blood pressure is really high. This will work quite fast as a Band-Aid to at least bring it out of a scary area. Doesn't taste good. Told you the warning, all right? But very quick actor. This, though, does have a threshold of loosening up the GI. So less will be more in this case. But yes, use it for these kind of cases of blood pressure cases, or you need a quick responding magnesium for somebody who's in a lot of pain potentially. So systemic and local anti-inflammatory effect of magnesium chloride in experimental arthritis, out of rheumatology. And then here again, NMDA receptor blockade in chronic neuropathic pain, a comparison of ketamine and magnesium chloride. So Not all of you are doing ketamine therapy. The ones that are not, here's an option to calm things down quickly. But again, be aware of the taste. I think it's something that you should all personally try and be aware of how effective it actually is, because it's a very simple form to get in. Then we have lipid X, magnesium oxide. You see that over here, double bond to oxygen. And then we have magnesium citrate. You're familiar with the citric acids. So we have oxygen and citric acid, or oxygen oxide. Now, people say, well, magnesium oxide is a very poor form of magnesium. But again, it comes down to what are we trying to do with the therapy? So this oxide has low bioavailability, but it has a high elemental amount. There's a lot of magnesium based on a small carrier. I'm working with a doctor and we're trying to get the most amount of magnesium with a good carrier into a capsule. And it's not always that easy. You got to work with capsule size and look at the carriers and what's going to cause the most, least laxative effect in what we're trying to do for this doctor. Citrate, good bioavailability. So here you're going to get bowel laxation. You're going to help constipation. But here's the silver bullet on this product. I was just listening to an audio earlier. Vice President of Biotics. He goes, that product was studied and developed for people who are trying to lose weight. Because when magnesium is taken with a meal, it binds with fat and makes fat into an insoluble soap. That's the silver bullet, I think, of the day. Just hit me. That when we take magnesium and we bind it with fat, that's what this product was designed for, is to take fat out of the system through the GI, so we're not absorbing fat. As Daryl was talking about it, if you're going to eat pizza or something high in fatty foods and you take lipid X with it, you're going to bind a lot of fat. That's not giving you the go-ahead for a fatty pizza, by the way. Once in a while, let's be real. But lipid X was designed to pull fat out of the meal, take it through the GI. So their stools will be much fattier. They'll take note. They're going to float, right? That's what's going to happen when we don't, emulsify our fats properly. But that's what lipid X was designed for, was mainly that purpose. That was a secret of some of the weight loss clinics, is taking magnesium with a meal. So if I was using Actimeg Plus, I would not take it with a meal. If you're going to use it at bedtime for sleep, or take it in the morning before your meals, or somewhere in between. So we're not using that magnesium to bind up a fat in the diet. Here's another one, magnesium orotate. Many of you may not be familiar, maybe you are, but this is orotic acid. Transports magnesium into the cell very effectively, okay? You're getting a fair amount of magnesium per carrier. You're not getting 400 milligrams of elemental like we talked about, but this is unique. If you're wondering where to use this product, let's jump down a line. Use it if you're working with cardiovascular focus. The orotic acid is a very strong antioxidant. Carrying that magnesium into the cell, we're getting strong antioxidant value for this product. It also enhances electrical conductivity. So when we're working with these difficult cardiovascular patients, magnesium, a very primary mineral for the heart muscle, to relax things, get proper electrical conductivity, this would be my personal choice. Magnesium glycerol phosphate, great. In these cases, may I use both? Because look at your elemental amount is only 62 milligrams per 2 capsules. You're not getting a lot, but it's definitely a therapeutic form for those cases. And this is kind of what I wanted to show you too. This is an interesting slide. Magnesium orotate and the gut-brain axis component. Why I want to show you this is because it just came to me today. The text question I got today is a young teenager with terrible anxiety. And what would I choose and what would I use in our supplement choice? It was Actimeg Plus, by the way. But here, just to show you, this is our youth. This is what I say. We all have these adult clients, but who's taking care of the kids? Top-down model, stress, childhood events, hormones, all that cascade, pushing that autonomic nervous system into sympathetic. Intestinal sensitivity. How many of you heard of teenagers with, oh, my GI aches, stress, blah, I don't feel good? And yes, it could be the diet. I've seen the diets of many of these kids, but it's also stress. You have the inflammatory cytokines, all of that goes on and on. And then the bottom-up model, GI infections, inflammation, dysbiosis, causing this excitatory in the brain. So targeting magnesium orotrate, this was a study, treatment with probiotics supplementation in patients with both digestive and psychiatric symptoms. I'm just trying to show you the importance of magnesium on even these kids. As I mentioned, that little boy with the tics, stress-induced. I bet you know a teenager somewhere having GI issues and stress, anxiety, nervous disorders, social awareness, and social anxiety. So the importance of that gut-brain axis, we can keep talking about that. But here's a nice little reminder of, well, what did we say? Stress, depleting the magnesium. These kids are not eating a high magnesium diet. And then what is their probiotics from? Antibiotics and the rest of the story, like nil, poor, dysbiosis, poor diet. So it's a balance of all of these. As a clinician, bless all of you for navigating that and finding the most valuable nutrient that's going to help these people the most. And then we have MGzyme, our magnesium aspartate glycinate gluconate. This comes in multiple forms. These are mostly your food forms of magnesium. This is a great one that's very titratable to help loosen up the GI. Bedtime, start with 100 milligrams. If they don't have a bowel movement the next day, give them 200 milligrams the next day and work to that dosing. I've seen it go quite high because people are very magnesium deficient. They'll get to 5, 6, 7, 800 milligrams, but you will titrate them down as they build up their magnesium status. Easy to scale, as I said, universal applications. If you don't know where to begin and you're looking, again, price point, you could start with MGzyme. Actimeg is a more pricier product, but again, I like the value of it. But MGzyme is a nice way to get started with 100 milligrams of food form carriers. These are amino acids, and magnesium in plants is going to attach to a glucose molecule, so it's just like what you're going to find in a plant. It's a great place to start. That's why it's a very popular product of ours. All right, there's your quiz question. I'm going to go back. Everybody get ready for your chat box. I want to give you that second to find your chat box on Zoom if you're not familiar. All right, ready? First answer in the chat box, get a bottle of Actimeg Plus. Wow, you're lucky. How many ATP are produced from the glycerophosphate carrier in Actimeg Plus? 5, 19, or 32? A, B, or C? It's a nice gift. It's a nice product. And you, if you haven't tried it and you win, please, it is so therapeutic. I have a young man, a doctor, who works with a lot of difficult cancer cases, and he uses it for his bedtime to calm down the brain. And he's only in his early 30s. Jacqueline over there is handing it over to me. Wow, great wins today. Maya, you're going to get a bottle. Arthur and Ted, I will get those out to you. Should ship in a day or so, and you should have them in a few days. I appreciate you all being here. I am going to do a class. It's short turnaround time, I know, but looking at my travels, holidays, and all kinds of stuff. Next one's July 18th. Building your best GI protocol. I talked about this in June of 2022, but I'm going to update it because, again, in social media, and everybody's asking me about colostrum products and immunoglobulins and what's the best for the GI. I'm going to give you some absolute silver bullet GI protocols, just as we talked about how these patients, these stress components are affecting the GI so much in all ages. And yes, magnesium is important, but let's look at also some of the foundational nutrients for the GI. So I will send that link out as well. I'm going to end right here so we can stop the recording, please, and I will open it up to the chat box. Again, thank you all so much for your time today.